The United Nations Children's Fund says Nigeria needs to raise more than $3 million by the end of the year to respond effectively to a diphtheria outbreak in the country. Diphtheria is a vaccine-preventable bacterial infection that affects the nose, throat and sometimes skin of an individual. Suspected cases have already been recorded in at least 18 Nigerian states, including the capital Abuja. Our correspondent Ajak Mangut tells us more.
30-year-old Safinatu Muhammad lives on the outskirts of Abuja. Nigeria's capital recorded its first case of diphtheria 2 months ago, and Safinatu says she's worried for her kids.
My children have not been vaccinated. Many years ago, a family member had a bad experience with a vaccine, and since then we've been skeptical about vaccines, especially the injections. But with this diphtheria outbreak, I'm worried because I don't want it to affect my kids.
Nigeria has been dealing with multiple outbreaks of diphtheria since late last year. Unvaccinated children aged 5 and below are most vulnerable to the disease.
UNICEF says more than 7,000 cases of diphtheria have been confirmed out of 11,500 suspected cases of the disease as of September. It also says more than 450 deaths have been recorded.
Health experts say a gap in vaccination in the last few years has contributed to the growing number of cases.
As you can see, what is happening now is the result of poor performances in the past. You see, I think that children 5 years and above, 5 years to 14 years that are most affected. Remember from the report that we have, and only up to 8 out of 10 of them have never had DPT containing vaccine. That is abysmally poor.
The United Nations Children's Fund warns that Nigeria needs to urgently begin widespread inoculation against diphtheria. It says $3.3 million will be needed to support the government in the procurement of vaccines.
Government cannot fund this intervention alone. This should be drawn from the private sector, organized private sector, corporate individuals and corporations should come together, stakeholders should come together. Let us have a plan, and everything should be done to ensure that we get potent vaccines into the arms of the people, into the systems of people that desire them most. And those are the children under 5 years and children under 2 years.
Nigerian health authorities say they are working with affected states to make sure at-risk populations have access to diphtheria shots. An emergency task force was inaugurated last month to manage suspected cases and curb the spread to other states. But it's worrying Nigerians like Safinatu, who urgently want the outbreak contained. Ajak Mangut, CGTN, Abuja.